So let's go 2019. There's a lot of exciting data, including in lymphoma, and we'll talk a little bit more in CAR-T in a second. But if you look at outside CAR-T for now, there's a lot of trials in progress of new concept where it's really early data, or again trial in progress, where they're trying to integrate novel therapy in the current concept of chemotherapy, either in conjunction or sometimes in lieu of chemotherapy to replace chemotherapy. As an example, there's this Smart Start trial from MD Anderson looking at interesting concept, looking at R-square ibrutinib in a frontline setting for large cell lymphoma, and with a response rate that is 85% over 60 patients or so, and then with a CR rate that is close to 40% after 2 cycles of non-chemotherapy option. And I think this is interesting because it gives an option to potentially patients who are not chemo candidate, but also maybe reduce chemotherapy in the future, or patients who are not great candidate for chemotherapy, particularly p53 positive, that are probably underestimated in large cell lymphoma. That would be one great option. So there's a number of other trials that are looking at building up on the other side with R-CHOP plus X. So this has been a strategy for now a number of years, with some issues of selection of a control arm. So many of these trials became negative, but there's some promising candidate now, looking particularly at antibody-drug conjugate, polatuzumab, and R-CHOP, and combination on ongoing trials. There's enzastorin combination, there's checkpoint inhibitors, so a number of different things. Another interesting abstract was about the combination of checkpoint inhibitors. This was a pembro plus BTK acalabrutinib across B-cell lymphoma, and we know that checkpoint inhibitors, particularly a single lesion outside of metastatic large cell lymphoma, in non-Hodgkin lymphoma has not been as obvious. But this combination was interesting with some patients who had a very durable response. So we see again the change of the landscape, integrating these novel therapy and offering new options in patients with a variety of lymphomas. We should mention also in novel therapy, there's some rare disease. Many diseases are becoming rare disease now, but NKT cell lymphomas that have no options in the relapse refractory setting. So sitilimumab is a checkpoint inhibitor with very promising phase 2 data, and this is going to be hopefully help continue to build up a platform in a disease where clearly there's unmet need as well.